says waiting. Yes, I got it. You're here.
I'm on my phone.
Okay. Okay. Yeah, that's what I'm using my phone too. It's a lot easier on the phone than the computer. I gave up on the computer. All right. So, well, thank you for tuning in to the chat. I was already kind of prepping people for the question. So the first question is, how are you dealing with the social distancing?
Well, good evening. First of all, I'm dealing. I think we're all coping. I mean, I was in my shower earlier, and I said, never would I have ever thought in a million years that I would be unable to do what I normally just get up and do. And I think we have no choice, actually. So I'm just coping. I mean, probably like everybody else, like you, we just have to do whatever we're allowed to do.
Yeah.
Yeah.
Ooh, yeah, it's tough. It's tough. So I'm gonna repeat the question for everyone else out there, so get a chance so they can comment. So how are you all dealing with the social distancing? Is it difficult? Is it not a big deal to you because you're used to being at home anyway? How is everyone dealing with the social distancing? It's the beauty of this new life. Okay, definitely. It's an eye opener. It's definitely an eye opener, I would say. Keep my
Something
mind
else I
busy.
thought about too yesterday is for the first time, I looked at it as a blessing. Because, for years, I mean, I have to commute about 45 minutes to an hour if there's traffic, hour, 10 minutes into work. And, sometimes, commuting, I get up at like 4:30, 5 in the morning, go to the gym, do my thing. And then I'm headed to the office, taking, JL or whatever to school and whatnot. And so sometimes I feel like I just sleep at home, because by the time my day ends, it's 6:37, 8. Don't let me go to choir rehearsal or something. It's 9:30. And so that can be like a whole week, and then you don't have that downtime until a Saturday. So that has been that really is our normal schedule. And so yesterday I'm like, this is a blessing, because I've never been at home this much. And I like my house. I like my house. I like my house and everything. So for the first time, I think yesterday, I said, Lord, this could be a blessing.
Yeah, it is. It is in a way. I looked at it that way too at the beginning, because our schedules are pretty jam packed and tight, and it does seem like you're continuously moving. You got all these, especially with kids, and they have their own schedules, and then you got your schedules, and everybody meet up at the dinner time, and then off to bed. And so then it's like, yeah, I pretty much just sleep here, and then the weekend I try to regain myself and then do it all over again. And now it's like the stop button for the world. So you're just sitting here like, well, I ain't got no choice. Now you start seeing things in your house. You're like, oh, well, I'm going to move this over here. I ain't cleaned that in a while. Okay. It kind of makes you appreciate your home and appreciate the time. Because I had said at the beginning, I said, you know what? I said, I hate that this is going on in the world, but I'm kind of happy because I needed this time. We needed this time. So, yes, definitely. So let me look at some of these comments. It's just difficult for my daughter to understand. Yeah, it is. It's hard for the younger ones to understand what exactly is going on in the world. And you kind of have to explain it to them on a level where they can understand. You don't want to give them too much information to where they're scared, but you want to make sure that they understand that what's going on is serious. And yeah, let's see what else. Kids, yeah, kids. I think kids are really dealing with it the worst because of school. And then, I know for a fact, like my kids, they're go-getters, so they're always moving. And then for us to be at home all the time, they're like, now we got to do you know, schoolwork on the computer, but then still maintain a schedule. It's just kind of like doesn't
Right.
make sense to them because they're like, well, we're at home. We don't have to do all this scheduling stuff. Now I
Right.
have to get up and get ready for class and be in front of the computer and turn in my assignments online. So it is a lot for the little ones, especially the little ones. That's something you normally don't have to worry about till you get to college.
Right.
So
Exactly. Exactly. And I think, I mean, you have smaller kids. I have a 16-year-old and a college student and an adult daughter. But my 16-year-old, I think after the first week or so, she was like, "Mom, I miss my friends. Can't
uh-huh.
can't such and such come over?" And I'm like, "Do you not understand?
Yeah.
She needs to stay in her habitat and
Yep.
we stay in our habitat." I mean, you know, and but you know, thank God her friends' parents were the same way, because the teenagers, they were like, "We just got to be together." You
Yeah.
know, and so then she was like, I want to go to school, and I'm missing basketball goals and practices, and yeah,
Mm-hmm.
I think the first couple of weeks were really rough for the
Yeah.
teenager.
Oh yeah.
Yeah.
I can imagine. Oh man, that's tough.
Yeah.
All right, let's see. Did we miss anybody? I think we got all the questions, answers for that question. So next question is, how has the coronavirus affected your profession?
Wow. Um, I'm a director of human resources, and so I am at the center, or human resources is at the center of this mess. And you know, being a director, I think I've done it all. I've had to lay off people, which we ended up having to do just almost 3 or 4 days after we were put shelter in place. I had to lay off 14 people. And I tell you, that was difficult. First of all, I had never laid off people um, remotely or virtually, so
Oh,
that I added that to my resume. But just the whole, I mean, everything, you know, unemployment now, you know, the whole care package that came out from the government, the federal government, just deciphering all of that that affects every department within a business. And I'm in higher ed, so there's so many guidelines, and you know, unemployment, can they qualify, you know, and just helping employees to navigate through that. I mean, and I think I have worked harder at home than I do in the office.
wow.
Without question, I wake up in the morning 7:30, 8 o'clock, sending emails off, and some of my meetings start at 8:30, and you're on webinars and Zoom meetings back to back to back.
Oh,
So
wow.
this has, you know, professionally, I'm exhausted.
Oh.
um, because of the major impact that it has on employees. You know, having to furlough, you know, I'm always reading, you know, universities and colleges are furloughing, you know, and several hundred, you
Uh-oh.
know, our college is not that big, but it's a massive mess. I mean, and just trying to keep employees motivated. I mean, for the first time, I had to roll out a work from home. You know, you have a loose work from home policy, but I had to tighten
Mm-hmm.
up, you know, and say, you know, effective this date to this date, we're going to be sheltered in place. You need to have access. So I had to put together like a policy, and a process, if you will, for our employees, because really our employees, our CEO really doesn't believe in work from home. So he expected me, yeah, to roll out, you know, how our employees will get along in these next months. And so, like I said, I think I worked harder the first few weeks, and it's still going, but at least, you know, I have some order now.
Yeah.
But you know, it's still, you still have employees that are home that are not absolutely doing anything. So professionally, it's been difficult. It's been difficult.
I can imagine. I can imagine that's tough being in
Yeah.
that position and then understanding as a human, like, okay, these people need to work. They need to support their families. And then to have to be the one to say, hey, it's time to lay you off. But here's the resources. I mean, that's tough. That is super, super tough because I don't think anyone has experienced anything like this before. Like, this is history in the making right now. And I don't know. Man, it's tough. I could just imagine working in the office and then just wait, I got to bring the office home. Especially, I know from my experience, I used to do social work. I worked in social work about 3 years. And because it's such a high intensity job and dealing with families, it's like, okay, work is at work. But then when I come
Yeah.
home, I have to shut it off. But then having to merge the two, it's like, I'm not getting a break here. So, I mean, I can only imagine having
Right.
to go through something like that. Let's see
Right.
some comments we got here. Someone said it's been pretty easy for me, but difficult for me. Okay, so that's the other question. Let's see. Social distancing is killing social interaction. So a lot of rebuilding will need to occur. Yes, I believe so. I think it's going to take a long time for people to kind of get used to the fact of being around people once this subsides and actually can get back to normal life. I think it's going to be very hard for people to readjust because we're going to be so used to keeping our distance from people and
Right.
things of that nature. Killing
Wearing
jobs is,
masks.
yes, wearing the mask. I wanted to know what that looks like in the future. Are they going to put laws in place to stop it when it's time? Are they going to allow us to wear our masks until we feel comfortable? I wonder what's the regulations of that's going to look like.
Well,
Um,
I think that that's going to have to be a part of, and long before, I think it was about a couple of weeks before we were issued the shelter in place. I had um, my assistant that reports to me. I said, I think we need to order a bunch of masks. And so she set out on Amazon. We saw a lot of gouging. We were only wanting to
yeah,
have about 100 masks on hand, and I think some of the vendors were charging $200 and $300 for just 100 masks. And so I made a joke to the CFO, and she's like, well, I don't think we're gonna need to open that can of worms. I said, no, I think we need to have them on hand, because I think that if an employee is uncomfortable, it's up to the employer to make them comfortable here at work. So whether they ask for it or not, you need to be prepared. And and that's what I still say. Whether they lift the shelter in place and they say Corona's all gone, I think that employers have to be prepared to make their employees comfortable.
definitely,
Yeah,
definitely. If they want to keep their employees, definitely want to make sure that they're
exactly,
comfortable and give them the option.
exactly,
I think instead of
exactly.
mandating, hey, everyone must wear a mask or no one could wear a mask. I think giving people the option to make sure that they feel safe, that's what companies should be doing. But
Right.
let's see, policies definitely be upgraded to allow technological advances our society has made. Definitely, and that's something else I wanted to comment on is how will things look once this subsides, and now that we have been accustomed to doing everything digitally online, is that going to change some of the policies and change some of how these companies, interact with their employees now that we know that it works?
Absolutely, absolutely. I think that um, employers now know that you can accomplish just as much. I think they knew, but people love to fly off on business trips, and nothing will ever replace face-to-face negotiating and so on and so forth. But I think that employers are gonna they're not gonna have a choice initially, but to continue to use this, because so much money has been lost. The economy has lost so much money, and so in order to recoup some of the financial loss, I think this is going to have to stay in place for a while. And then people will get back to flying and meetings and business travel. But I think employers now are going to have to say, hey, Zoom is not a bad thing.
Yeah.
Definitely save money. Right.
Definitely, definitely. I agree. All right, so we're going to go ahead and move on to the next question, which is how has the coronavirus affected religion? What's your
Oh
thoughts on
wow.
that?
Oh wow. I tell you, it has affected um when you say religion, the
Hmm.
faith, the faith, I'm
Yes, the
sure
faith aspect and just churches in general.
exactly. Faith wise, I think that we are coming together more. But
Okay.
when you talk the church building, who would have ever
Hmm.
thought that every church building now would be empty? That is massive right there. That is
Oh, yeah.
massive. If you ever tune into a mega church or a big church, and or even our church, and we, every now and again the camera, will show you the empty pews from where the pastor is standing. That is scary looking.
That is. That
So
is.
it has really, impacted the church. The church or us, the body of, but just the physical building and going, not being able to go in, and you still have, seniors and people that are not all this technologized as the younger generations, and so that they're not able to log on and see, and worship. Our church, we have a very progressive pastor, and
Hmm.
so we tonight, after I get done with this, we have our Bible study, which is on Zoom, and our church service and everything is being broadcast, but it's not going to take the place of the physical, and I think that has really shook the church, not being able to gather together. That's
Oh,
what we
yeah.
do. That's what we do as a culture.
Yep. Yep. That's true.
Yeah.
My thoughts on that with when it comes to people's faith and when it comes to religion, I've seen because I pay attention to a lot of different social medias, and I see some of the things that people are posting and them just expressing themselves. And I feel like right now is a serious test of faith. And a lot of people are so scared from what I've seen that they're actually, forgetting, that God is powerful. And
Yeah.
they have kind of faith and then they have fear, but fear is kind of taken over to the
Hmm.
point where some people who you think are believers are starting to not believe. And it's like, no, this is the moment. This is the time. The
Right.
times like this is when you're supposed to believe. And
Exactly.
as far as the church, I've seen a lot of smaller churches get kind of criticized for not accommodating their members, but you have to realize a lot of some of these smaller churches aren't progressive, that they don't have the technology. A
Right.
lot of their members are older, so then it's like they don't know how to work those things, but they know this church has been going for years and decades, and this is the way they've been
Right.
doing things. And so then some people are kind of just, well, what, just kind of coming for churches, and it bothered me. It bothered
Right.
me because I'm like, you have to be understanding that not everyone is in the same space, and
Right.
okay, you can't tune in, you can't go to your church physically, but there are thousands and thousands of other churches online that you can attend and get your reading, get your message, get your praise on,
Right.
listen to the songs.
Right.
There's lots of other churches you can go to online, but I don't think it's right to kind of criticize, some of the smaller churches. Um,
Oh no! Right during this time, it's not good to criticize at all. Now's the time for every church to band together. So if there are larger churches that are in the areas, and they are in fellowship with smaller churches, it would be my prayer that they would all join together somehow. I know our church, um, we fellowship again with other churches. Maybe their technology is not as good as ours, and I know our pastor is very, like I said, progressive and very welcoming, and extending invitations and whatnot. But you're right. Now's not the time to criticize. Now's the time to, everyone reach one,
right,
that
exactly.
that type of thing, and band together. because smaller churches. I mean, they started that way, and and tradition is it can be crippling, but I think too
Mm-hmm.
churches need to think outside the box. I saw something the other day. I don't know if it was on Facebook or something, where they were in the parking lot,
Mm-hmm.
um, standing, far away from each other, but still yet in the parking lot. And so, whatever, a church can do to continue to fellowship and worship, I think we have to do that.
Definitely, definitely. All right, let's see. Keep your literature close. Okay, I don't think we have any other comments on there. Um, and then, yeah, so I kind of went into question 4 a little bit already, which is, do you feel the pandemic has challenged a lot of people's faith? So I think it has. I definitely think it has challenged a lot of people's faith, because now they're, like I said, you're faced with something that you can't control, and you kind of got to just let it happen, and just, for me personally, I'm real big on family. So I feel that, if I've heard people throw out terms, this is the end of days. Okay, if it is the end of days, you can't control that. So just cherish the
Right.
moments that you have and the people that you have in your life, and continue to connect with them the way that you can. But there's no
Right.
sense of, losing your faith or losing your mind. I mean, I saw someone literally on Facebook, someone had recorded someone had took their own life, jumped off of a building, because they couldn't handle the stress of what's going on in the pandemic. And I've read an article about a young girl. She's a teenager. She was 15 years old, and she committed suicide. And so I think you just got to kind of really use this time to connect with the people around you.
Mm-hmm.
Um, so yeah, I think it's challenging for some
It, it
people.
it is definitely challenging. If you're not automatically a self motivator, something like this is a defining moment for you. And this is also in your Christian walk or your faith. If you're not reading your Bible, and you're not already, if you weren't already doing that,
Mm-hmm.
and you were just relying on going to church that Sunday and getting your word, and starting back on Monday, you may be struggling right about now.
Mm-hmm.
Um, because right now is the time for, if you say you're a Christian, it's like you got to be about it. I mean, you've got to be self-motivating to pick up his promises, which his promises are in the word. You've got to be self-motivating to listen to all kinds of podcasts, that, with good Bible teaching pastors. You're going to have to strengthen yourself. The song say, encourage yourself. Now's the
Mm-hmm.
time that you're going to have to encourage yourself, because I mean, Sunday you're going to get it online. If your church can have a Bible study virtually, okay. But there's all sorts of things that you're going to have to do to strengthen your faith.
Mm-hmm.
And even if you don't even know how to do any of that, prayer, some people, they have this misconception about prayer, that you have to know everything. You don't have to know anything but know God.
Yeah,
and
I think that's it.
right, some people, I don't know how to pray. Yeah, you do.
It ain't a
If you just
secret
say,
formula.
Lord
It ain't.
help. Right. If you just say, Lord help, that's a prayer right there. And
Mm-hmm.
it's this is a time for the believers to draw closer to him. I just think that we have all this time for a reason.
Mm-hmm.
um we can't just run off to the church now. The church is right there in your home. So
Mm-hmm.
now is the time for you to worship in your church, in your home, like never before. And you don't have to worry about who's standing next to you and what they wearing and what you wearing. Now you can you can get in your pajamas right here in the middle of the
Mm-hmm.
floor. You Now's the time to draw close to him, right
Definitely,
where you are.
definitely, definitely.
Yeah.
So prayer is okay. So prayer and meditation will connect you with the Most High God. Yes, that is very, very true. A lot of people, like you said, there's no special formula. Just it's just like having a conversation. It kind of
Yeah.
baffles me when I hear people say, "Well, I don't know how to pray." I'm like, "Well, you talking, right? Okay, so just talk to God. Just
Mhm.
talk. That's all. It doesn't have to
Yeah.
be a format to it. Just express how
Right.
you feel, and just keep it going. But just I don't know. I just think people just need to kind of do what they can to stay positive in this situation. Um,
And the
let's
thing
see.
about it too, just touching a little bit on the praying too, some people think again you have to be so eloquent. God is so loving and so faithful. He
Mm-hmm.
already knows your heart, and you don't have to say it any kind of way. Just say it. If
Mm-hmm.
you're hurt, Lord, I'm hurt. If you're confused, Lord, I'm confused. Can you help me?
Mm-hmm.
You don't have to, be so eloquent as, some people may think, and, the old people say, we grew up, and not even old people, but, the Bible says that he can interpret your moans and your groans. And so sometimes you don't have to say anything, just moan, and he gets the message. So now's the time for people, us believers, to moan if we have to, whatever we have to do to get close to him. I'm serious because
Exactly.
right, right.
All right, so let's see here. Question number 5, which is our last question, which is it says, so with some states anticipating to reopen by the end of the week, do you feel that it is too soon?
I don't think that that's going to even happen. I think that there's been so many people that have downplayed this, and
Mm-hmm.
I think that people need to be careful and pay close attention to. People have died.
Oh
There has
yeah.
uh, um, I don't know, over, I don't know, 20 something thousand or 40 something thousand deaths,
Mm-hmm.
worldwide or
It's
nationwide.
Yeah,
It's
the
a lot.
numbers are still going. It is. It's a lot. I was pulling up the information for Georgia. And then that's the reason why I brought that question up, because in the state of Georgia, I'm not sure about any other states, but I knew I was concerned about my state.
Right.
And Governor Kemp, which is the governor of Georgia,
Mm-hmm.
he had a press conference this week, and he talked about reopening Georgia, some of the non-essential businesses in Georgia. So these were gyms, fitness centers, barbershops, nail salons, hair salons, and massage parlors. So his point was, he was saying that a lot of small businesses are suffering.
Mm-hmm.
So the state of Georgia went from April 30th. So April 30th was supposed to be the original date to kind of open the city back up and start everything moving along. And then the date changed from April 30th to May 13th.
Mm-hmm.
And then now they went from May 13th to this weekend. So as of Friday, they're looking to open up all these businesses
Oh
in
wow.
the state of Georgia. Yeah, and so I'm not really worried about it because none of those really pertain to me. I will continue my workouts at home, but I don't think we're ready at all.
Right.
Um, just pulling up the numbers, there are about 21,000 cases of coronavirus in the state of Georgia and about 846 deaths. Um,
Wow.
I
Wow.
definitely think it's too early. And during that press conference, he also stated that they're expecting the numbers to go up after opening up all these small businesses. So,
Well,
do you think it's too soon?
unless I think it's too soon, and unless these small businesses are prepared to have the mask or
Mm-hmm.
prepared to give the 6 feet distance, if they're tons of hand sanitizer.
Mm-hmm.
Now, if they're prepared for all of those things, and we're talking small businesses, and they can practice, safety, okay,
Mm-hmm.
fine. But if they're not prepared and then it's too soon. It is very it's too soon.
Yeah.
Because I think you need a plan,
Yeah.
and but if the state of Georgia also, and I used to hate CNN. Oh, well, I hate CNN. I used to love CNN, but here in these last 4 years, I hate CNN. But
Yeah.
either way, I have paid attention in these last few weeks, because if we still don't have the proper way to test people,
Hmm.
that alone right there will tell you it's too soon. So
Oh
if
yeah.
Georgia has a for sure way to test people quickly, um, as well as facilities for when they get sick and have to be hospitalized, if they
Hmm.
are ready for all of that, then hey. But most states are not prepared for that yet.
And I truly don't think that our state, Georgia's not prepared for that. I definitely don't think it. And this is just my personal opinion. My first thought is when I saw the list of the small businesses that they were planning to open. These are high contact businesses, so you have to have some sort of human contact. The barbershops, the beauty salons, the nail shops. That's really really close contact. And I'm talking maybe less than a
Right.
foot apart. You right there up on somebody.
Uh-huh.
So, and then the massage, like all of that is high contact. But also these businesses, and I know someone else that comment on it. These businesses, in my opinion, as well, is targeting minorities. Um,
Mm,
Atlanta specifically, the city of Atlanta is heavily populated with African Americans, and so
mm,
I honestly feel that there's a target situation going on, and a lot of
mhm.
people are going around saying, I'm woke and I know what's going on. I mean, are you really seeing what's going on? Because the mayor of Atlanta was this Mrs. Keisha Lance Bottoms. She explained that any decision made by the governor is superseded, of what she's saying, but she has advised everyone to stay home, even though he is opening the state back up. And I think that kind of and
I'm 50. I'm 54, and but the gym is not full of African American people. We don't take care of ourselves, and when we get sick, we try to fix it with an old remedy. We can't do that.
mm-hmm,
And so I think that our population is hardest hit because we're a little bit stubborn,
mm-hmm,
and we don't have the resources that
true,
other um, nationalities have, or
yeah,
other races
yeah.
have. We just don't have the resources.
That's true. I agree. But my first thought was when it came to um, the African American population was our health habits. Even though we may not have the access to adequate health care, and people don't really think it is that important until you get sick. But I think the
Right.
preventative care, which is the way that you live your life, the lifestyle
Hmm.
that you live, the healthy eating,
Right.
paying attention to the things that you put in your body. Um,
Right.
that's like the biggest thing, which could keep you out of the doctor's office and the
That's right.
hospital. But I think
That's
a lot of us are kind of still kind of so used to tradition, and this is how it was
hmm
before me, and this is how this person was before me. But don't you think there should be some changes as the time progresses? We want to live a little longer. We need to eat a little
right.
healthier. You
hmm
know, um,
hmm
I think that's definitely a big one. Let's see some of the
Right.
comments. Minorities have limited access to preventative care services and ongoing care, so they're already considered immunocompromised on a much larger scale. Okay, Brittany. All right.
Yeah.
Black people are
That's true.
also afraid of the Tuskegee. Now, I've heard about someone had brought that up. I think I read an article about with them trying to reopen some of these states or planning to reopen. Is this
Hmm.
another Tuskegee experiment?
Experiment.
I just really want people to just be careful and be aware of what's going on. Um,
Right. Right. Right.
we always have. Oh, see, here's one thing. As as a people, we've always had large families and dwelled under the same roof and close knit. We also sometimes can afford to stay home or have the mansions or big homes to social distancing. Yes. Now that brings up a good point because I had listened to, I can't remember what celebrity it was, but a celebrity had commented about, how people who have a lower, economic status or living in poverty are living
Hmm.
in multi-family homes. So you got brother, sister, cousin, uncle, everybody's living under the same roof. And if one person gets infected with this coronavirus, there's a high chance that they don't have insurance coverage. They go to the hospital, they patch you up, and then they send you back home with the virus to infect the rest of your home. You can't quarantine
Right.
if you don't even have your own room or your own space, you
Right.
know? So that's why I kind of feel like when it comes to minorities, like folks have got to wake up and really pay attention to what is going on.
Right.
Um,
Right.
they're really patching them up and throwing them out,
Right.
and they tell
And
you to quarantine.
right. And but one thing that we can be so proud of, that we are a smart people.
Oh yeah.
We are, even if our my parents did not have college degrees, but they were smart people. They were
Mm-hmm.
entrepreneurs and whatnot. So I mean, we just got to be smart. If you're not feeling well, don't go to work. I mean, that's
Exactly.
that we're gonna go back to our faith thing. God gonna take care of you, but just stay home. But some people
Yeah.
feel they can't afford it. You know,
Mm-hmm.
we've just got to be smart. You know what's a few dollars if you die, if you get
Right.
so sick.
Exactly.
If you need to stay home, just stay home. That's where our faith kicks in. God will take care of you. So
Definitely.
we can't let people, like you were saying, this Tuskegee experiment. We have to pay attention, and not even allow something like that to happen ever again.
Definitely. Definitely. I think people just need to just really pay attention. I really want
Right.
people. Some people are, especially those who are of lower economic status, when they feel like, oh, if I don't work, then I don't eat. If I don't eat, then I die. Okay, well, if you go to work and you get infected by something or someone, and then what you gonna do then? You
Still gonna
know.
die.
So I think still gonna die. So I think, as far as like this whole experience of going through this, I really hope that people kind of relook at their financial situation
Hmm.
and kind of think more on a broader scale instead of living day to day, week to week, check to check. Because there's some people that live like that and don't have to.
Hmm.
And, so maybe kind of coming up with a plan. So if something like this ever happens, you can afford to take that time off and be okay. I think this should be an eye opener for a lot of people because
Oh
it's
yeah.
been a little over a month now that we all been, quarantined and then it's like some people are really struggling. So I
Hmm.
really hope some people kind of rethink about the way that they're distributing their finances and ensuring that they have some sort of savings plan or just
Yes.
kind of calm down on the frivolous spending. Do you really need this? You know what I'm saying?
Yes.
So when times like this, which are so drastic, you're okay. The stores. I mean that when this whole thing first happened, I kind of felt it was coming.
Hmm.
And that day that everything started progressing just around the city of Atlanta, I started seeing different counties closing schools. So I said, okay, well, if they're closing schools and I live outside the city, we're probably next. So let me go to the store, get some extra groceries, make sure we're good. And it was chaos. I never thought that toilet paper would have been such a big deal.
Right. Yeah.
But,
It was
I
it.
was like, I didn't
Right.
understand it. I was like, oh, wow, I didn't know this was going to be crazy like this. And people are just hoarding things. And I don't know. I just feel like people just need to be, take everything in that's going on and make adjustments to your life. So,
It kind of caught me by surprise because the public schools did close. Few start to close, but my daughter goes to a private school,
mhm.
and I'm listening to the news, and public schools were closing, and I'm like, is your school closed yet? No. So I think
Mm-hmm.
her school was like one of the when her school closed, I knew this was serious.
Yeah, it was serious then. It
It was
got real.
serious at that point, and I'm like, hey, okay, now the private Christian schools been closed. This might be something going on, but because
Mm-hmm.
really, I mean, once the schools, some of the public schools started, I and then I heard about the toilet paper and stuff, but it didn't really hit me until I went to Costco, and
It was tough.
Costco's line was down the street, and I said, what is going on?
Yeah,
But
it's like what in the
yeah,
world?
yeah,
It got
yeah.
real.
It got real. It got real. And you brought up another point, and I don't know how we are for time, but I like what you said. Now is a good time for us as a people to pay attention to our finances.
Mm-hmm.
If we don't have to spend it, don't spend it. But it also is it's an eye opener for us. We need to save more.
Oh yeah.
And spend less, because this caught us by surprise, and if you don't have 2 or 3, or really you should have 6 to 8 months of savings, that could cover your bills, or especially your mortgage, or your rent or whatnot. That would be
Mm-hmm.
idea. And if you don't have 3 to 6 to 8 months saved, you need to really get busy and saving it, and instead of spending. Yeah,
Definitely. Definitely.
yeah,
All right, so we got some comments let's see. Don't forget about the prison and inmates dying from the virus and can't escape. Oh yes. That's a good
yeah.
one. Yeah, I did read about some of that too. I actually saw some videos about inmates that are being infected by the virus, which doesn't make sense because if they're in prison, how is
Right.
it getting into prisons?
That
You know, um,
that was my
that
my question.
it just
So
doesn't make sense
what
to
what
me.
what I what came to me was when I asked the same question. They're in prison. They always sheltered in place.
Mm-hmm. Right,
um,
exactly.
but then somebody told me the guards,
Mm.
the prison guards, are out and about. So I didn't have, of course I haven't had any data on that, but I guess that would be, the
That
answer.
would that would definitely make sense. It's just it's kind of messed up for them. Everybody makes mistakes, and some people may be in there for things they have or have not done. But to to be stuck in a situation like that and still not getting equal rights as a human to
Right,
actually you can't distance yourself if you're in a 6 by 9 cell and
right.
you this close to somebody. There's no way you can social distance. I actually saw a short video clip online somewhere, and it was like I guess someone has snuck a phone into the prison, and they were explaining what was going on in the inside, and the person that was in the same cell of them was dying, had the virus, was wheezing, and they were explaining how one of the nurses just came in, threw a whole bunch of masks, and said, about 80% of y'all are going to die. Good luck. So it's just like, wow, that's pretty tough, especially for some of these people who don't have violent crimes or offenses, and they're in there for a short period of time, and then you go from that to you know get risk of
Yeah,
dying of a virus, and you can't control it. So I think that's tough. I saw a lot of petitions too online, people trying to reach out to their family members, trying to get them out because of what's going on in the prison system. Um, looks
yeah.
like
I have a friend. I think she was tuned in. Her sister is a correctional officer, and yeah, it's co-workers that get it, and they're around the correctional officers. And again, you don't know you have it for at least what, 14 days or so. And
mm-hmm,
so by the time that correctional officer possibly goes to work, and come in contact with the inmates. I guess that's how it
Yeah.
would get into
How?
the. Hmm.
Huh. That's tough.
Yeah.
Let's see. We
There was
got.
another comment that says World News said that men are dying more than women.
Oh wow.
Yeah.
Hmm. I
Huh.
wonder why is that.
Well,
That's very interesting.
I would think that's because men are still out there trying to work. They still out there trying to provide for their families and somehow, and they're not necessarily practicing the 6 feet distances, distance between each other. And I mean, if you're out there, doing construction work on the highways and whatnot, um, I would see that they're getting sick more than women. I would
Hmm.
think, but I've not seen numbers.
Yeah, I haven't seen those numbers, but yeah, I could see that being
Hmm.
the reason. And then men just seem like they're less likely to go to the doctor anyway or admit
Right,
that they're sick. So, yeah, I could
right,
see their numbers being higher.
right.
Men less likely to go to the doctor's office than women.
I agree.
Um, this one says definitely release them if they are not a harm to society. I can agree with that. Like I said, if these prisoners are in there for nonviolent crimes, then they shouldn't be held in that situation. I think there should be something to where they can have the right to protect themselves from the virus.
Right.
Um, but yeah, I think that is all of our questions for today's chat. I want to thank you for coming on and sharing
Thank
your
you.
knowledge and your presence and energy. I definitely appreciate it.
Thank you for inviting me. This was fun.
Thanks. Yes, yes, yes. All right. So definitely maybe we can have you come back later with the coming up months or so, hopefully when this is over with.
Okay,
But yes,
absolutely. I'm gonna have
definitely.
to tune in more. You guys are on Wednesdays, right?
Yes, yes. So right now we're doing Wednesdays and Thursdays, and then and some days we're doing Wednesdays a consistent day. So it's either Wednesday and Thursday or Wednesday and Saturday. Thank you for tuning into the Stamp Nation chat. Be sure to follow us on all social media platforms and to check out our website for updates.